Welcome to our exploration on bipolar disorder, a mental health condition characterized by significant mood swings, including manic highs and depressive lows. Today, we will be focusing on an individual who may be feeling excessively impulsive, euphoric, and energetic. Let's watch today as Julia enters Dr. Mercer's office and they talk about the typical behaviors of this manic state.
Hi, I'm Julia. I'm here for my 10 o'clock appointment.
Nice to meet you. Come on in. So what are you here for today?
Well, as you know, I sent in my email. I'm 20 years old, college student, and I go weeks with experiencing really high highs, and then all of a sudden it'll be like 2 weeks of really low lows.
Can you explain some of the things you've been feeling recently?
Well, on the really high highs, I experience a lot of erratic decisions and making impulsive decisions, like spending an entire paycheck that I just got the day of, and my family members have noticed that I've been different.
That does make sense because during manic episodes of bipolar disorder, normally individuals often experience increased impulsivity, elevated mood, can also lead to impulse shopping sprees like you're experiencing. These actions are also driven by a heightened sense of confidence, urgency, and strong desire for immediate gratification that skew their financial judgment.
Okay, yeah, that makes sense because typically I see myself doing things and being excited about things I'm not usually excited about, or I'm jumping from one task to another, hanging out like with people more, like being louder, being more talkative. Like my dopamine levels, I can feel like they're so much higher than they usually are.
That makes sense to hear. So now let's move on to your depressive episodes, and can you tell me about the things that you experience during those periods?
Yeah, and during my really low lows, it's kind of like I don't even want to get out of bed. I don't want to go to work. I don't want to do any work. It's hard to go to school. It's even hard to see my friends. My roommate has a hard time seeing me like that because she'll see me being really happy, and then all of a sudden I won't be talking and I won't get out of bed. So it's kind of hard putting her and my friends and family in positions like that.
Can I talk to you for a minute?
Yeah.
So I've been noticing some changes in your behaviors that I think we should address. I've been noticing you've been using my credit card. I noticed that there was a $500 charge the other day, and I think that's kind of unacceptable. I've been doing my own research lately, and I realized that bipolar people usually have impulsive decisions, and I think you've been dealing with that a lot lately, so I think we should try to get you some help right now.
I agree with you. I'm sorry. I'll get help. I realized after my episodes that I really wanted to stop harming others and me.
I just want to let you know that what's happening to you is not your fault, and it's not because of what you're doing. There's disorder in your brain, and I'm going to go through what's happening to your body and why you're reacting this way. So first I want to talk about your neuroanatomy.
What's that?
So normally in bipolar patients, your HPA axis does not function properly when you're going through these manic episodes. And normally patients with bipolar disorder exhibit a faster cortical thinning in the middle temporal cortex. So I don't want to overwhelm you, but normally people who have bipolar have increased activation in their left amygdala and their hippocampus. And that normally is happening when they're recognizing sad faces.
That's very interesting.
So going into the structure and function of your cells and your nervous system, normally bipolar patients have a decreased prefrontal cortex that has altered dopamine levels and serotonin activity, which are what are causing your mood swings and your shifts in energy levels.
I get the energy levels thing 100%. There's been times where I want to work out every day, be active all day, go outside, stuff like that, and then it'll be the next week and I just want to lay in bed and I never want to work out again.
I also want to touch on the communication between your neurons.
That's funny you say that because when my brother talked, he actually told me that he did some research and found some stuff.
I've done my own research and I found that it affects the prefrontal cortex, the amygdala, and hippocampus. In the hippocampus, I found that it's been reported that there are alterations in both the electrical and the chemical neurotransmission within the hippocampus. And also, the alterations reported in this is in the release and uptake of neurotransmitters such as GABA and glutamate.
It means a lot to me that you looked into this so much.
Also, it's been found that there's an increased activity in the dorsolateral prefrontal cortex requiring selective attention.
Interesting.
In regards to the amygdala, the activation is much higher in patients with bipolar disorder than without.
I really appreciate my brother looking so deeply into this because it makes me feel more understood and comfortable knowing that he doesn't think that I'm crazy and he knows that there's something actually going on and there's something wrong and it's not just me.
Yes, I'm so glad you said that because I want to reiterate that what's happening to you is not your fault, and I'm going to help you get through it, and I want to eventually give you ways to help cope with it.
We now know that bipolar disorder significantly alters the neuroanatomy of the brain, which also means it significantly alters the communication between neurons in the brain. For example, it disrupts the normal release and uptake of neurotransmitters like glutamate and GABA, affecting memory and emotional stability. Additionally, the neurotransmitters in the HPA axis is affected by overactivity in this structure, causing an increased amount of corticotropin-releasing hormone that regulates the HPA axis. An increased amount of the corticotropin hormone will lead to influences in mood and stress responses.
And I want to ask, have you ever sensed any changes in your vision?
Very interesting that you mentioned vision, because I actually did research and I noticed that my eyes will like kind of randomly just like shift and move without me even like trying to do that or thinking about it, and my vision is definitely sharpened or heightened. Like, I understand why it's called a hive and like why my feelings are heightened, because when I'm having these manic episodes, everything seems brighter and like everything around me just seems more like vibrant. After doing my research, I realized it's a problem rooting from my visual cortex.
I also want to touch on the somatosensory system. Normally patients have decreased gray matter volume in their left somatosensory cortex, and this affects patients in how they process their emotions, the prevalence of how they do their risk taking, their responses to stimuli, and this is all due to changes in their somatosensory cortex.
Those with bipolar disorder may struggle to pick up subtle tones and changes in people's voices, which can make it harder to understand emotional nuances in conversations. This is mostly due to changes in the temporal lobe, changes in the superior temporal gyrus, the Broca's area, and the amygdala, which all play a role in emotional processing. And this can lead to difficulties in social interactions, impacting how well somebody with bipolar can interact with others and connect with others.
Olfaction, or the sense of smell, is subtly yet significantly affected in individuals with bipolar disorder. Studies suggest that these individuals might experience alterations in their ability to detect, discriminate, and remember different smells. These changes are potentially linked to alterations in brain regions involving olfactory processing, as they can influence everyday experiences and interactions ranging from eating habits to social behaviors. Individuals with bipolar disorder may experience changes in their ability to taste, which could be influenced by mood, state fluctuations, and medication side effects. Such variations in gustatory function can affect dietary choices and nutritional intake, complicating the management of this disorder and impacting overall health.
Getting into motor control, have you ever experienced kind of a sway when standing?
Yeah, I've noticed that when I do stand up, it takes me longer to catch my balance and kind of find my footing.
These motor symptoms are believed to stem from abnormalities in the cerebellum, basal ganglia, and another area such as the brainstem.
After this session, it's leading me to believe that you may show some symptoms of bipolar depression. I'm going to do some tests on you, and we're going to meet again a couple times a week. It's come to my conclusion using the DSM-5 criteria and other tests that you do have bipolar depression.
I'm glad we came to a consensus on what exactly is going on and a final diagnosis, so we can take further steps from here to help me cope and get through this.